Hello and welcome to Missoula Aging Services New to Medicare presentation. My name is Chris Hightower. I am a resource specialist and state health insurance assistance program counselor, also known as a SHIP counselor here at Missoula Aging Services. And I'm going to take y'all through our New to Medicare presentation. All righty, here we go. All right, first up, we have our mission. Here at Missoula Aging Services, we promote the independence, dignity, and health of older adults and those who care for them. Our mission. Here at Missoula Aging Services, we are the voice of older adults. We provide programs and services in our communities, empowering people to age with confidence and without fear. First, we'll review a few of our services here before we jump into the content of Medicare. Some of our services we offer here. First up, we have a call center for immediate assistance. This is important because when anyone calls Missoula Aging Services, you're going to get a human being that answers the phone. And they can direct your call to the right department or where it needs to go and give you that immediate assistance right out of the gate. We help with referrals for food, housing, homemaking, and transportation, and also provide consultations for Medicare, Medicaid, and finances available by appointment. We have caregiver support groups, respite, and community classes. We also have a wonderful volunteer program and provide advocacy and fraud prevention. We serve older adults, veterans, adult children seeking help for parents in or out of Montana, and people of all abilities and income levels. All right, our class objectives here. After the presentation, you will understand the differences between original Medicare with a supplement and Medicare Advantage plans. When you can enroll in Medicare supplements, Medicare Advantage plans, and Medicare Part D, enrollment periods are very important. We'll make sure to get those hammered pretty well. And where to find financial help and how to seek out advocacy and support if you suspect Medicare fraud. All right, here we go. Into the maze that is Medicare. Okay, what we have here is our diagram of the new to Medicare roadmap. And so as you see here, we have original Medicare or a Medicare Advantage plan, the two routes you have to getting your Medicare. All right, first up, we'll review original Medicare here with your Part A hospital insurance, your Part B medical insurance, a standalone Part D prescription drug plan, and a Medicare supplement. All right, so first up, the foundation of Medicare is your Part A and your Part B. Everything stems from that. So first up, we'll just review Part A. Okay, so here we have it. There is a premium for your Part A. However, you would have had to have worked less than 40 quarters of your life, or about the equivalent of 10 years. So for most folks, a premium for your Part A is $0 a month. There is a deductible, and it is $1,632 for each inpatient hospital benefit period. Now, that is a 60-day benefit period. So if you go to the hospital, it's going to be a $1,632 deductible. If you are discharged from that trip to the hospital and you return 45 days later from discharge, you will not pay that deductible again. However, if you are discharged from the hospital and 60 days pass and you enter the hospital again, it will be another $1,632. All righty. And there are some co-insurance days. Your Part A benefit will cover days 1 through 60 in the hospital. After that, it's $408 per day for days 61 through 90. and $816 a day for days 91 through 150. All right. Here we have a little bit more information here on Part A and when we enroll. If you're collecting Social Security Administration benefits, Part A and Part B will automatically start on your birth month when you turn 65. You can postpone Part A and Part B enrollment if you have credible, keyword there, credible coverage, and you'll need to contact Social Security Administration to enroll. All right, if you're contributing to a health savings account, also known as an HSA, you may need to stop contributing before enrolling into Medicare. This is not the case for a medical savings account. Okay. How does Medicare work with the Affordable Care Act? If you have a plan through the marketplace, you will lose your tax credit. And you can keep that plan if you would like, but without the tax credit, it is usually more expensive than any other option we will discuss today. Okay, back to our roadmap. So we discussed Part A. So let's go over Part B. All right, Part B, also known as your medical insurance. So let's think outpatient, outside the hospital. Primary doctor's visits, specialists, physical therapy, durable medical equipment, services like that. There is a premium for your Part B, and it is $174.70 a month. And that can be higher for those depending on income and in higher income tax brackets. There is a deductible for your Part B, and it is $240 annually. So if we remember, the Part A deductible is only per 60-day benefit period. For Part B, it is annually, and that amount is $240. All right, then there's a co-insurance for your Part B, and that is 20%. So Medicare pays 80% of the Medicare approved cost, and then you are responsible for the remaining 20%. Like Part A, there's no out-of-pocket maximums here, and there are preventative benefits. There are some preventative services under Part B that Medicare covers 100%. Okay, when to enroll? Your initial enrollment period is what we call it when you turn 65. So your birthday month is what everything is kind of hinged on here. So if you enroll in Medicare any month before your birthday month, coverage will begin on your birthday month. Okay? If you enroll in Medicare on your birthday month, then coverage will begin the following month. If you enroll in Medicare a month after your birthday month, coverage will begin the following month. All righty. Okay. All right. For Part B, if you have credible, meaning as good or better than Medicare's coverage, employer-based health insurance, you can use that coverage and wait to start Part B later without a penalty. And where you can get that information is by talking to your benefits coordinator or human resource person at your work. Okay, if you're collecting Social Security, your monthly Part B premium will automatically be deducted monthly from your Social Security check. And remember, that amount is $174.70 a month. However, if you are not collecting Social Security, you'll need to call Social Security to sign up for Part A and Part B, and you will be billed quarterly for your Part B premium. Again, that is if you are not taking retirement benefits when you enroll in Part B. Okay, when to enroll? Say you continue working past 65 when you're Medicare eligible. You have credible employer group coverage, and you retire. You have an end date in mind when that employer group coverage is coming to an end. When do I enroll in Medicare? So you will need to enroll in Part B to avoid a penalty within 8 months of your work insurance coming to an end. Okay. So then once your Part B begins, you'll have 2 months to start your Medicare Advantage plan if you choose to go that route. 2 months to start your Medicare Part D without a penalty if you choose to go the original Medicare route. And 6 months to enroll in your supplement if you choose to go the original Medicare route. That period is known as your guaranteed issue right. And we'll discuss more about that when we get to supplements. Okay, so as we can see there are some costs that come with Medicare Part B. So you may qualify for financial assistance that pays for Part B deductibles, co-insurances, and co-pays. Here we have a graphic here of our state funded financial assistance entities that help pay for those costs. Okay, so if we can see here, there are 3 different levels of what are known as Medicare Savings Programs, MSPs. The first level is QMB, Qualified Medicare Beneficiary. And then you can see the household number of folks in the household, their monthly income limits, and asset limits. The next level is SLMB, and you can see the income limits and asset limits to be on that level of a Medicare savings program. And then finally, you have QI, qualified individuals, and you can see the income limits here. Okay, so go back here to qualified Medicare beneficiaries. Here's the level that pays deductibles, co-insurances, and co-pays for Part A and Part B services. SLMB, specified low income Medicare beneficiary, just pays your Part B premium, the $174.70 a month. And then QI, very similar, they pay the Part B premium as well. But you do have to qualify and be eligible to receive these services through the Department of Health and Human Services. Okay, back to our roadmap. Alrighty, we've discussed Part A, hospital insurance, and your Part B, medical insurance. Next, let's continue down our roadmap here and review Part D, prescription drug plans. All right. Here we go. So, Part D, where we review prescription drug plans and compare plans and review our options, is we review or look at Medicare.gov. All righty, please do not go to Medicare.com to get the most accurate information. We encourage people to go to Medicare.gov. All righty, I'm going to stop sharing here for a moment and we'll go review Medicare.gov. This my goodness gracious. Where are we here? Okay. All righty. Hold on here, having just a bit of trouble. Okay, sorry about that. Here we are. Here we're back in the game here. All right, we're on Medicare.gov. Here's where we can review prescription drug plans and Medicare Advantage plans, but we're going to start with Part D's. Okay, so if you already have your Medicare card and you have your Medicare number, you can go ahead and log in and create an account. I'm not going to go through that process because I don't have a Medicare number, but it's a pretty simple process and you could do that here. But you can also review plans without a Medicare number. Let's go to Find Plans Now. All right, we'll enter a zip code. We'll just do a local one here, 59801. Continue. Medicare Drug Plan Part D. Find plans. It'll ask you if you're getting any assistance from any programs to help pay for drug costs. For the sake of this, we'll say we don't get any assistance. All right, do you want to see drug coverage? Let's say yes. Next. All right, so here we can enter any and all medications, and you can enter your medications. So let's start with some common ones. Lisinopril, add drug. And here's why it's important to know your dosage and know your quantities. Because there's quite a few options. Let's just go with the 10 milligram. We'll do 30, one a day every month. Add to my drug list. Add. Let's throw in a little more tricky in there. Let's just say metformin, for example. As you can see here, there are quite a few different options of metformin. Again, why it's important to know what medication you take. Let's just use metformin hydrochloride. Woofda. Look at, we got quite a few different dosages here, so you'll need to know your exact dose. Let's just change it up a little bit, and you can say how many you take each day. You have the option of changing to, if you're on a 90-day refill regiment, or 6 months or 12 months, but let's just leave it how it is. So that's 60 every month, 2 a day. Add to my drug list. Okay. Another good example, let's throw a more expensive medication on here. Let's go with Eliquis. Add to drug list. Again. Boom. And do 60 every month. Add. Let's go with Celebrex. Okay, so if you have a brand name medication and there is a generic and you type in the brand name, what'll pop up will be a notification box here that will tell you there is a generic version, and you have the option of adding the generic or keeping the brand name. Let's add the generic. Okay. And we got our dosages here. Add to my drug list. Add another drug. Let's just go back and add Celebrex again. And let's keep the brand name this time so we can kind of see the difference. Add to my drug list. Okay. All right. We got a nice handful of medications here. All right. Then we can add our pharmacies. Okay. If you kind of scroll down, you could see other options, and you can compare up to 5 different pharmacies at one time. So we could pick some of the common ones here: CVS, Walgreens, Costco. You can see them populating down at the bottom there. So we have 2 more. Let's enter a couple more. Let's choose a local pharmacy. I think Palmer's is a local. Oh no. How about Sorry, let's use Missoula Pharmacy instead. Missoula Pharmacy, and then, oh, maybe Costco, sure. And then Costco. So you can see down here at the bottom, we'll compare pricing for the medications we entered at these 5 pharmacies. Okay. All right, here we go. Now we can see they have generated the plans that best fit the medications we entered in the pharmacies we entered. And you can see here, they filter plans by the lowest drug and premium cost. You do have the option of switching the criteria here. But let's most often we stick with lowest drug and premium cost. All right. So they think based on the medications and pharmacies we entered, the best plan for this individual would be through Medicare Blue RX, PDP prescription drug plan for $20.20 a month in a premium, and then a total drug and premium cost for the rest of 2024. You can see the amount here. And with a deductible of $545, a common deductible for prescription drug plans. So we can compare 3 of these drug plans side by side. Let's grab the first one. We'll just scroll down, WellCare. And we'll scroll down and get the third best plan. You can see they populated at the bottom, compare. All right, now we got them next to each other here. Again, in the first column here, we have the best plan based on lowest drug and premium cost, the second best, and then third best, Humana on the right. Okay, we can see their premiums next to each other. We can see their yearly deductibles. And then if you scroll down, you'll be able to see how much a total drug and premium cost will be for the rest of the year. So you can compare your numbers next to each other. So let's just go a little deeper into the best plan. You can see plan details here. All righty. And here you'll be able to see the deeper details of this specific plan. Again, we have your premium, we have your yearly drug and premium cost. Then it'll tell you here if they cover all meds or not. So here we see they're only covering 4 out of 5 drug medications. So it's likely why we have quite a high number here. Okay. All right, then we have your drug list that we entered. Here's where we could see with this plan, you could see which pharmacies are in network versus Walgreens here, who is preferred in network. And generally folks who go to the pharmacy that is preferred in network do get the best price. All right, here's where we can see the yearly drug cost by pharmacy. So you can see right off the bat here, that one medication that is not covered is the brand name Celebrex. And it has taken up majority of that yearly drug cost at every pharmacy. But the generic version of Celebrex, the celecoxib, much cheaper. That's why it's important to know if you're actually taking the brand name or the generic. You can also see Eliquis, a generally expensive medication. You can see how much it'll cost over the course of a year at each individual pharmacy. Here's where it'll break down for you when you'll meet the different coverage phases of a prescription drug plan. It'll tell you here when you will meet your drug deductible, and they're telling us it will meet next month, or in April. When you will enter the coverage gap at the end of the year, and it'll let us know that we're not getting out of the coverage gap. Okay, then you can see your estimated keyword there, total monthly drug cost at each pharmacy. So you can go look and see how much you can expect to pay in a copay when you go pick up your medications at each pharmacy. Okay. All right, here is where you can see the breakdown on how much you would expect to pay for each medication based on their tier system. So preferred generic, $2 copay, a generic medication, $6 copay, preferred brand name, $42, non-preferred drug, 46% the retail cost, and specialty tier medications, 25% the retail cost. So then we can see here, not covered medication, that's where we're going to get in trouble here. The celecoxib is a tier 2, the Eliquis is a tier 3, and then we have a couple tier 1s. Then it'll show you towards the end here the star rating, which meaning overall happiness with the plan. And got 4 out of 5 stars, which is pretty decent. Okay, I'm gonna go back to the top here. I'm gonna continue to go backwards. I'm going to go backwards one more time. Let's go, and I'm going to remove that Celebrex brand name because it is skewing our numbers and it is not covered. Done adding drugs. We'll keep our same pharmacies. Okay. All right, so now you can see our drug costs went down, but it is still high because that Eliquis is expensive. Okay, so then you can see a little more reasonable, accurate drug plan premiums or so for folks on common medications we see here at Missoula Aging Services. Okay. I'm going to go back to our PowerPoint here. All right. So we've reviewed Medicare.gov and prescription drug plans. All right. So a few things to note about Part Ds. They change every year. But don't worry, here at Missoula Aging Services, we can help review your Part D plan during open enrollment each year. When is open enrollment? It is October 15th through December 7th of every single year. Everyone who is on a prescription drug plan or your Medicare Advantage plan has the opportunity to review their plan and make changes if they need. And Part D plans are through private insurance companies. All right, so there are late enrollment penalties if we do not get into a Medicare Part D plan within 2 months of their Part B starting. And that penalty is roughly 1% of the average Part D premium for each full month you went without having coverage. So every month you go without having a plan, you are accruing a penalty, and it is growing. Part Ds, they're safety nets in case you need medications. So even if you don't take any medications, you do still need a Part D or Medicare Advantage plan. So you are not accruing a penalty. but it will be there. We never know what happens with aging. We could be prescribed something at any time. So it's a safety net that we will have drug coverage if something were to happen or we are prescribed a med. You may need to wait, though, until open enrollment to get into one. You can't just get into a plan at any time of the year. And there are possible subsidies to help with drug cost. All right, so you can go yourself to visit medicare.gov/plan finder and put in your medications, select pharmacies, and compare plans. We'll also help you do that. And if you don't feel comfortable or just need assistance, please make sure to contact our call center, and we'll make you an appointment. We'll go through it with you. Okay, Part D financial assistance. You may qualify for reduced Part D premiums and lower your prescription copays. There are a couple different programs. The first program is through the Social Security Administration, known as Extra Help or Low Income Subsidy. So you could see here the household folks in the household, the monthly income limits, and the asset limits. Okay, the next program is a state-funded program known as Big Sky RX. Okay, and then you can see your household, your monthly income limits, and your asset limits. Extra Help, they can help reduce copays, deductibles, and premiums. Big Sky RX will give you a portion of money each month just to pay premiums. All right, back to our trusted old roadmap again. And now we're gonna keep moving down our left side here, and we're gonna go over Medicare supplemental insurance, also known as Medigaps. Okay, Medicare supplement insurance help pay the out-of-pocket cost, such as deductibles and co-insurances for original Medicare Part A and B services. All right, you'll need to speak to an agent to sign up for one because they are through private insurance companies. And you do bring your red, white, and blue Medicare card and your Medicare supplement card with you to appointments. We bring that up because it's a little different for Medicare Advantage plans, and I'll talk about that here a little later down the road. And for more information about Medicare supplements, you can be found at csimt.gov. Okay, now the CSI stands for Commissioners of Securities and Insurances. All right, what does supplemental coverage look like? Okay, here we have our graph that kind of explains the different coverage options for the different plans. Okay, across the top here in the columns, we have the different plan names, and they are lettered as well. It is Plan A, Plan B, Plan D, G, K, L, M, and N. And then we have over here in the gray columns, different plans C and F. However, you would have had to have been eligible for Medicare before 2020. And then in the rows here, we have the Part A and Part B services. Okay, so first up, we have your Part A, co-insurance and hospital costs. Now remember, those are $408 a day for days 61 through 90 and $816 a day for days 91 through 150. So if you are on one of the plans with a check mark here, you will be covered up to an additional 365 days after Medicare benefits are used. You don't pay any of those co-insurance costs. Next, we have your Part B co-insurance or co-pay. Now that is the 20% you are responsible for after Medicare pays their 80%. And you can see the plans with check marks that cover that 20% in full. versus plans K and L who cover a portion of that, a percentage of that 20%. And then N here with the 3 stars next to it, they just ask for a flat rate of $20 for office visits and a $50 copay for emergency room visits, which otherwise with plans with check marks would be covered and you don't have those copays. All right, now we have your first 3 pints of blood. You can see the coverage there. Then we have Part A, hospice care, coinsurance or copay. You can see the coverage. Now we have your skilled nursing facility care coinsurance. So if we look over here, your Part A benefit covers days 1 through 20 in a skilled nursing facility. After that, it is generally $204 a day for days 21 through 100. However, if you are on a plan with a check mark, those plans will cover an individual up to 100 days in a skilled nursing facility. Now we have your Part A deductible. Now, that is the $1,632 that is due to the hospital per 60-day benefit period. However, if you have a plan with a check mark here, you don't pay a hospital deductible. It is covered. Now we have your Part B deductible. As we can see here, no check marks, no plans available today or since 2020 cover the Part B annual deductible of $240. Most folks on Medicare and all folks entering Medicare now do have to pay their annual deductible at the beginning of the year. Alrighty. Then next we have your Part B excess charges. What are those? So Medicare sets prices that they're willing to pay for services. MRI costs this much. A hip replacement costs this much. Knee replacement costs this much, so on. So providers can choose to accept Medicare as a form of payment and accept assignment from Medicare. By accepting assignment, it means that they're willing to take whatever Medicare is willing to pay as payment in full. However, the other option is Medicare providers can choose to accept Medicare as a form of payment, but decline assignment. By declining assignment, it means that they are allowed to charge up to 15% more for services. That MRI, that knee replacement. And there's only one plan available to folks entering Medicare today, and that is Plan G that covers those Part B excess charges. And then we have foreign travel emergency. You could see here, we really encourage folks to really communicate with their plan to learn exactly what that looks like, because it's generally understood that Medicare is not accepted outside of the United States. Because if Medicare Part A and Part B won't pay, they are the primary, then your secondary here, your supplement can't pay either. So really encourage you to talk to your plan to learn. But a more reliable option, we encourage folks here to get traveler's insurance, much more reliable. Okay. And then we got a couple of the plans, K and L here do have out-of-pocket yearly limits, and that's because they do have more out-of-pocket costs for services. Okay. What is the guaranteed issue right? We mentioned it a couple times. And that guaranteed issue right is the period, the 6-month period that you have to buy a Medicare supplement policy after your Part B begins, unless you're on Social Security disability. Those who are on an SSDA, DI may be subject to medical underwriting and higher cost. But it's really important during that 6-month period to get your supplement, because during that time you shouldn't be asked medical questions. You shouldn't be subjected to medical underwriting. And most importantly, during this period, you cannot be declined based on pre-existing conditions. However, if you were to postpone, procrastinate, forget, 6 months pass, maybe we're 8 months past your Part B beginning, you're like, oh, I got to get a supplement. you may be subjected to medical underwriting. And you could potentially be denied coverage based on pre-existing conditions. So it's important to enroll in a supplement if you choose to go the original Medicare route within 6 months of your Part B beginning. All right, we're back to our roadmap again. So we have just reviewed original Medicare. That includes your Part A hospital, Part B medical, Part D drug coverage, and your supplemental coverage. All right, let's move on to the other side of our roadmap here, and we'll review Medicare Advantage plans, also known as Part Cs. And what they do is they combined your Part A and Part B, and usually Part D drug coverage, all into one little plan. All right, Advantage plans. There are a couple different styles here. The first one is an HMO, which is a health maintenance organization, and the other is a PPO, preferred provider organization. An HMO simply means that they have a network of in-network providers with the plan, and you do have to go see those providers to get the best cost for services. And if you are to go out of network, you will be paying out of pocket costs for services. With PPOs, preferred provider organizations, a little more forgiving. They have providers that they prefer you see that are in network with the plan. You're going to get the best price to see them. However, if you do go out of network, you will have some coverage. Okay, Medicare Advantage plan coverage. They do have maximum out-of-pockets for hospital and medical services. They may include some dental, hearing, or vision coverage. They may include a gym membership. And Medicare Advantage plans have deductibles, co-insurances, and co-pays. These could be higher or lower than those of original Medicare costs after adding up over the course of a year. All right, where do we go to review Medicare Advantage plans? We visit medicare.gov/plan finder. We'll do the same thing. You enter your medications, select pharmacies, and compare plans. You can check what providers are in network. And again, just to hammer it home, we can assist with that process as well. And we are happy to. It's a lot of what we do. So if you have any concerns, please let us help you. All right, I'm going to stop sharing and we'll go back to medicare.gov and we will review Medicare Advantage plans. Okay, we are back to medicare.gov. So we had our prescription drug plans. If you would notice, up in towards the top right of the screen here, it'll say underlined, view 17 available Medicare Advantage plans. Let's go ahead and click that. Okay. So again, Medicare.gov will filter plans by the lowest drug and premium cost based on the medications we entered and pharmacies we entered. So they believe, based on those criteria, that the best plan for this person would be the Humana Choice per PPO plan with a premium of $0 a month and a total drug and premium cost of $487 a month. There's an annual deductible of $550. There is a drug deductible, and there are in and out of network maximum out of pockets. So again, let's compare the top 3 plans. Next up is another Humana plan. And then the third best is we have here a Blue Cross Blue Shield plan. But you can continue to scroll down though and compare other options. We'll compare the top three. Here we have them. You can see their star ratings, their health deductibles, their drug plan deductibles. You can compare maximum out of pockets. And you will notice here, Part B premium. Folks on Medicare Advantage plans do still have to pay their Part B premium. And that is $174.70 a month. However, they do not pay another premium for their Medicare Advantage plans. Well, for the two Humana plans we have here, it is $33 a month for the Blue Cross. Okay, then we have a check mark and X list here for services that they cover. Unfortunately, in Montana, you won't find plans that cover transportation, in-home support services, or home and bathroom safety devices. Okay, and here's the breakdown. What does it cost to visit your primary doctor? As long as they're in network, $10 copay. $10 copay, $0 copay over here on Blue Cross. To see a specialist, as long as they're in network, $45 copay, $45, $34. And it is a different cost for out of network. So you can kind of scroll through and review all the different services, and you'll be able to see what co-insurance or copay they charge for that service. Okay. You can review what it costs to go to the hospital. And here are some of those added benefits: hearing, dental, and vision. Okay, and then they'll have your drug coverage towards the bottom here, how much it costs for all those medications over the course of 2024. Okay, there you have it. When we can go a little deeper if you would like. Plan details for that Humana plan. Okay, up top here, we have the plan website you can go to. And then, just like we kind of reviewed already here, you can see all the specific services and what copay or co-insurance they have. Okay. And we're happy to go through all this with you again and dive into your unique situation and help pick the best plan for you. Okay, so I'm gonna stop sharing. Let's go back to our PowerPoint here. Okay. All righty. That is Medicare Advantage plans. Oh, a little bit more information on Medicare Advantage plans and their enrollment periods. Advantage plans, you can review and make changes to your plan during open enrollment, which is October 15th through December 7th, to have your new plans coverage begin on January 1. And Medicare Advantage plans also have their own enrollment period, and that one is January 1st through March 31st. Okay, and when you go to the pharmacy or provider appointments, doctor's appointments, hospital, you present your Medicare Advantage plan card and not your original Medicare card, your red, white, and blue card to healthcare providers. You get all your services from your Medicare Advantage plan. All right, we got a comparison guide here. On the left side, we have Medicare supplements, and on the right side here, we have Medicare Advantage plans. Supplements are guaranteed renewable. They roll over every year. Coverage does not change. There's nothing you have to do. Not the case with Medicare Advantage plans. You do have to shop every year to make sure the plan is still the best plan for you, because they make changes to how they cover medications, what pharmacies are in network, how they cover services, what providers are in and out of network. So they make changes. So it's always good to review every year. With supplements, they do have a limited guaranteed issue right. Now that's that 6-month period you have to get into a Medicare supplement without being denied based on pre-existing conditions. So there's a limited time period to get into one. But that doesn't mean you can't get into one if you miss that period. If you're generally healthy, you'll should be no problem getting into one. But just know that after that 6-month period, private insurance companies, they do not have to accept you. Okay, with Medicare Advantage plans, there's a limited provider network, the HMO or PPO we discussed. With supplements, you can go anywhere Medicare is accepted in the United States. You just have to make sure that wherever you receive your services, they do accept Medicare as a form of payment. If they accept Medicare, they accept a supplement. Medicare Advantage plans do have maximum out-of-pockets, so you won't likely pay copays and co-insurances until the end of time. They do set limits. But you do have copays and co-insurances for every single service you utilize on a Medicare Advantage plan. With supplements, they possibly cover all of those copays. Plan G, for example. And some Advantage plans have lower premiums, so $0 premiums. So the trade-off here is supplements, you have higher premiums, but you don't likely pay for any services, no copays, no co-insurances. Versus Advantage plans, you have $0 premiums, but you pay for every service you utilize. Okay, one last time to kind of hammer home some of these ideas here of when your employer group coverage ends. You have 8 months to start your Part B without a penalty. Once your Part B starts, you'll have 2 months to start your Medicare Advantage plan, 2 months to start your Part D, and 6 months to start your supplement. Okay, back to our roadmap here. All right, so we got a little bit of information here on how to prevent fraud. Our Senior Medicare Patrol program helps combat some of that fraud, neglect, abuse, and they're advocates. So every single year, there is at least $65 billion due to fraud, errors, and abuse. Medicare processes millions of claims every single day. Mistakes do happen and they can be costly. But there is also fraud and abuse out there. So the Montana Senior Medicare Patrol program is a federally designated entity for reporting cases of Medicare fraud, errors, and abuse. The Senior Medicare Patrol's mission is to empower and assist Medicare beneficiaries, their families, caregivers to prevent, detect, and report healthcare fraud, abuse, and errors through outreach, counseling, and education. If you suspect Medicare fraud, give us a call here at Missoula Aging Services, and we can assist you with navigating those waters. Here we go. We have just some extra information regarding the Senior Medicare Patrol program and what services they offer and can help with. Okay, now I got a video for you to watch here. I'm going to stop share. I'm going to share my screen. All right, so let's go and check out Missoula Aging Services website. All right, you can find us at missoulaagingservices.org. Here is our homepage. And you can see across the top here the different ways to get help or get involved. And a little bit about us. But for the sake of where we're going here, let's go to Get Help, Medicare and Finances. And we're going to go to Senior Medicare Patrol. Okay, we'll scroll down. All right, I'm going to go here and we're going to watch a YouTube video. Well, I better stop share real quick here, actually.
It's your journey.
Oops. What's going on here?
If you need insurance from a change in life.
All right, one moment. We're getting there. Share screen. Okay. All right, sorry about that.
Do you understand your Medicare summary notice? This is not a bill, so this page shows what services were billed to Medicare. It is not a bill itself. Always check this statement before paying a bill, and only pay the amount on the provider's bill after you are sure everything is correct. Okay. Under Service Provided and Billing Code, you're supposed to read this information and ask questions if you don't recognize a service. Mistakes happen, and you are the one who knows what services you received. Also, the mistake may be on everyone else's as well. A $9 duplicate charge returned $1.37 million to Medicare when one woman in Iowa noticed and reported an error. It looks like under the columns it shows what was charged and what was approved and paid by Medicare. Medicare generally pays 80% of what they approve, and you owe the remaining 20%. If you go to a rural clinic, they may pay the provider more than was billed, but you'll still owe the same 20%. If your provider does not accept Medicare assignment, you may owe up to 15% more. Under the maximum, you may be billed part. If this says you owe zero, you owe zero. Do not pay a bill when Medicare says you owe zero, and never pay more than what you see in this column. They say if you do not recognize the provider or the date, ask questions. If the information is incorrect, it could mean someone has stolen your identity or is a simple mistake, but it needs to be corrected even if there is no charge to you. Routine electrocardiogram, EKG. Yes, I remember getting one of those. Medicare processes over 5 million claims a day. You are more likely to find fraud or errors by reading your statement and asking questions if you do not understand a charge. The services should be easy to understand and would line up with your bill. It looks like 2 services were denied. If services were denied, it may be an error, and you could pay more money out of pocket if you do not question something you do not understand. It would be a red flag if the denied service was also from a provider you do not recognize. Notes for claims above. It says to always look at the notes section of why services were or were not covered. Okay. Under C, it says my claims were sent to my supplemental insurance. Make sure the supplemental insurance is correct. If it is not, and you haven't read your MSN, you may pay a doctor bill you don't owe. And finally, why my claim was denied. If a service is denied, call your provider first. If you need help understanding what to do, contact your local SMP. You may need to file an appeal, or it may be a simple mistake cleared up by a call to your provider. Now that wasn't so bad. I really think I understand how to read these now.
Okay, good deal. So hopefully that makes sense, and feel more confident in reviewing your Medicare summary notice and how to look at charges and how to see how you were billed and how to identify mistakes. But we can help though if you suspect mistakes, fraud, abuse, bring them to us and we can help. All right, let me share my screen again, back to the PowerPoint. Okay, we watched our video. Okay, Here we go. We got some identifiable logos to keep an eye out for. When you receive mail about Medicare, these are logos that can be trusted. We got CMS, which stands for the Centers for Medicaid and Medicare Services. We got the Department of Health and Human Services, DPHHS, Big Sky RX, Social Security Administration. These are credible entities that aren't going to send you junk. So if you receive mail from them, probably take a look at it. So yeah, most these agencies will not contact you first, usually, like Social Security, or so on, or even Medicare, 1-800-Medicare. You have to initiate a conversation for them to reach out to you. Okay, I'm sure we're feeling like this right about now. It's a lot of information. Thank you for going through it with me and taking the time to watch this presentation. We hope you enjoyed it. I hope you enjoyed it. But no fear, though, if we still have lots of questions or you want to dive deeper into your situation with one of our SHIP counselors, please make a one-on-one appointment by contacting Missoula Aging Services at 406-728-7682. And we'll get you scheduled for an appointment, and we'll get you taken care of. Okay, thanks again for spending time with me and going through this presentation. Have a good one.